Say, given all the problems that we've seen with people trying to enroll in this program, is the White House going to be delaying the mandate?
That's not at all what I was saying.
Here's, I mean, John. I mean, why not delay it? I mean, you're going to charge people a fine for not enrolling.
We're 3 weeks into a 6-month enrollment period. As I said, the law itself, as written, makes clear that Americans who have access to affordable insurance would need to have insurance by March 31st. But people who do not have access to affordable care, due, example, to a state not expanding Medicaid, and there are states out there who are depriving their own residents of access to expanded Medicaid because they made that choice, or due to other factors, will not be penalized. That's number one. And when it comes to the issue I was just talking to Brianna about and the February 15th marker period in terms of enrollment, I would refer you to HHS for more details, but they are working to align the policies, the disconnect between the open enrollment period and the individual responsibility timeframes, which exists on the first year only. The point I'm trying to make, John, and addressing the question at the end of your question is we're focused on providing quality health insurance to millions of Americans. We are 3 weeks into a 6-month enrollment period. If you enrolled last week or you enroll next week, your insurance does not kick in until January 1st. And ample prior experience shows that in programs like these, most people don't enroll until towards the end. If you're able to shop for an extended period of time before you have to buy, you're likely to shop. And in Massachusetts, for example, where a similar healthcare initiative was passed into law, the average consumer explored his or her options 6 to 8 times, I believe the figure was, before actually making a decision. So again, we're acknowledging clearly, as the President did, that the problems that have existed on the website are not acceptable to him, that we are focused on making the consumer experience better, providing clear information to Americans about the variety of ways they can get the information about plans, as well as the variety of ways that they can enroll to them. And our focus is on making the Affordable Care Act work and making sure that Americans have access to these plans, not on figuring out who's to blame for a problem that clearly exists and we need to fix.
Just basic language. I'm saying you can't really charge people a fine for not getting health insurance if you don't fix this mess.
John,
you can't make the website work, can you?
I appreciate what you're saying, and I have answered now and will answer again that people who do.
Let me spell it out. If the website's not fixed, will people still have to pay the fine?
First of all, we're way still early in the process. So you're talking about a February 15th and a March 31st deadline. It is October 21st today. So let's be clear about that. We're 3 weeks into this, and that's number one. Number two, as written, the law makes clear that people who do not have access to affordable care due to a state not expanding Medicaid or other factors will not be penalized.
So those factors can be this website